Well, I would say to him that, look, Jay, there are two sides to this. You're hearing, obviously, one, the Obama side. Perhaps, I guess that's the one you're wedded to. But there's more to it than that. To me, as I said before, I don't think it makes a lot of sense to so quickly surrender 1/6 of our economy to the government. I think I'm not saying that our present healthcare system is perfect. I'm not saying that at all. But certainly I think that, we don't need to jump in and discard it and throw the baby out with the bathwater and, undertake a massive program that I don't see how we're going to finance it. I really don't. I mean, I would say it's probably going to result in two things. One, increased taxes, and two, healthcare rationing. I don't think there's going to be, quote, enough health care to go around for everyone if the government simply says, well, yeah, it's free now, here it is, come after it. And I think that will result in health care rationing. I think probably the people who's going to be on the short end of that stick will be senior citizens.
There were people that became my family, and the only problem was they had no health insurance, they had no jobs.
And I think what's frustrating is if we were on medical assistance, or if we didn't work, we wouldn't have to worry about this. I mean, because it would be paid for. We would have that medical card and we would just say, here. It's frustrating for us because we have integrity and we have principles and we want to pay what we owe fairly. But we're not able to do that and nobody's out there to help us. But if we didn't work and we didn't contribute, we wouldn't have to worry about it. And we'd be able to spend the time that we do have at home with our twins, who we feel like we haven't seen in the last 4 months because we're at the hospital all the time.
You know, my guess is there's 158 million people who get their insurance from big companies. And my guess is that there'll be a lot of those people, even though they know that they're paying a little bit more, or they don't know it, they'll probably stay with a lot of that. And my guess is that public insurance at the beginning, out of the sheer terror of the thought of it, all wrong, will get relatively few people. But I think those will grow as people, it will force people to become more sophisticated about the insurance market and what they're getting charged. And I don't want, insurance, you do have to pay premiums. This doesn't eliminate premiums, but it eliminates the obscene profits in what is a rapacious, in my judgment, profit-driven industry. And I'm sick of it, and I want to end it.